My screen here. Yeah, it looks like we're right at 11:30 here. So I'll just start by welcoming everyone back. We're going to revert to our traditional format this week with Dr. Pryor, the president of Essentia Health East Market, starting us off, and he will be followed by Dr. Van Dielen, Chief Medical Officer at St. Luke's. After that, we'll go to questions, and I think I can finally forego those instructions. I think after 5 weeks, everyone knows how to ask a question at this point. We'll again shoot for right around 45 minutes, leaving a few minutes at the end in case any of the four doctors have a few closing thoughts they'd like to circle back to. As a reminder, we have our infectious disease specialists, Drs. Prabhu and Thompson, with us as well. So we'll shoot for about 45 minutes and try to wrap up right around 12:15 and turn it over to Dr. Pryor.
Welcome back, everyone, on this beautiful Thursday day. I'm Dr. John Pryor, president of Essentia Health's East Market. It's hard to believe this is our 7th press conference. I'd like to start by discussing measures being taken to keep patients safe at our hospitals and clinics, including emergency rooms and urgent care centers, as well as our pharmacies. This is such an important message. I can't reiterate that enough. I realize some folks are reluctant to visit us over fears of COVID-19, and I want to reassure them that both us and St. Luke's are working diligently to protect every single person that enters one of our facilities. It's vital that you get the care you need when you need it. Delaying that care and ignoring severe symptoms can be life-threatening. We have noticed that in a lot of cases, the typical number of patients we're seeing for chest pain, heart attacks, strokes has decreased in the emergency departments, and people are staying home instead of getting the care they need. And this is not good for their health. It could be, as I said, life-threatening. At Essentia, some of the steps we've taken to ensure your safety include, number one, establishing alternative patient flows so that COVID-19 patients are kept separate from others, creating negative airflow rooms and increasing the number of air exchanges per hour to limit potential exposure to the virus, screening everyone who enters our buildings, both staff and patients, meticulously cleaning and sanitizing our rooms, and using processes aimed at killing viruses and bacteria, such as UV light technology, restricting visitors. Additionally, we're asking all our staff, patients, and visitors to wear a mask to limit the spread of the virus. And we continue to follow best practices as outlined by departments of health and the CDC. Hospitals and clinics remain safe, even through this public health crisis. Protecting you and your loved one is our #1 priority. I mentioned face masks, and that's something we stress the importance of wearing. We strongly encourage patients and visitors to bring their own, but when that's not possible, we'll provide one. In order to do that, however, we continue to request the community's help. On Monday, Essentia and St. Luke's announced our Land of 10,000 Masks campaign, which seeks 10,000 cloth face masks. These are really effective at slowing down COVID-19, which is spread through droplet transmission. And other items can be brought to our Miller Hill Health Plaza in the former Yonkers building or at VIP Plaza in Superior. I can't say this enough, but thank you to all the folks who have sewn and donated masks already. We're so grateful, and yes, we want more. A couple of additional notes before I turn it over to Dr. Van Dielen. Essentia is offering a cutting-edge therapeutic treatment in which convalescent plasma is used to treat COVID-19. This means people who have been exposed to COVID-19 in the past. It's going to allow those who have recovered from COVID-19 to donate plasma so we can infuse it in critically ill hospitalized patients who meet specific criteria, which will provide antibodies that could help them recover. Second thing I want to let you know is since we expanded our testing last week to include all symptomatic patients, we've seen a steady uptick in administered tests. For example, last Monday through Wednesday, we averaged around 223 tests per day across the Essentia network. This Monday through Wednesday, we averaged 363 tests, which is a 63% increase. Finally, if you've had symptoms such as fever of more than 100 degrees, a persistent cough, shortness of breath, headache, sore throat, new loss of taste or smell, or muscle pain, we encourage you to start an e-visit, which is free for COVID patients. Go to Essentia Health, search e-visit. There, your symptoms will be evaluated, and if necessary, a test will be ordered. You also can call our hotline at 833-494-0836 to be evaluated. Once more, 833-494-0836. Medical order, just to remind everyone, medical order is required before you can be tested. Please just don't show up at the testing site, expect to be tested. So I thank all of you, and now I'm going to turn this over to Dr. Van Dielen.
Thanks, Dr. Pryor. We're very pleased to be entering into the mask partnership with you, the 10,000 mask donation campaign. This is a great opportunity for us in the community to come together to ensure everyone is properly protected from the COVID-19 virus. If anyone would like to donate masks to St. Luke's, you can drop them off at the St. Luke's Foundation in the Northland Medical Center on St. Luke's campus. While on the topic of PPE, I'd like to note that St. Luke's patient-facing employees will soon be wearing face shields in addition to masks to ensure better protection. This is what that looks like. We believe that this is the latest recommendation from the Minnesota Department of Health and will help us protect our staff and our patients. I'd also like to add that thanks to the generosity of Northlanders, we have been able to distribute iPads to all St. Luke's inpatient units. Since we have had to limit visitors due to COVID-19, this will help patients and their loved ones stay connected. This is a great service that we are proud to be able to offer our patients and their loved ones during these difficult times. In regards to testing, we'd like to note that it's now easier than ever to get tested for COVID-19 at St. Luke's. That's thanks to the recently adjusted Minnesota Department of Health testing guidelines and their expanding capability to allow for testing of up to 20,000 people per day. Certainly aspirational, but we applaud them. Those wanting to get tested can go to the St. Luke's Respiratory Clinic near Home Furniture and Fleet Farm in Hermantown. The clinic is open 7 days a week from 8 a.m. to 5 p.m. I'm going to repeat the symptoms just so people know, but people with symptoms including sore throat, cough, headache, fever, chills, muscle pain, shortness of breath, difficulty breathing, or a new loss of taste or smell are encouraged to go to this location for an evaluation. As Dr. Pryor said, you do need to have some sort of an evaluation, so the test is ordered, and that could be an e-care visit or a visit at the respiratory clinic. If a person believes they have COVID-19, they will be tested, and the result will be available within 24 to 48 hours, and we will call them. No appointment is necessary. It's extremely safe to undergo this evaluation and testing. We have a great team there waiting to help you. In speaking of appointments, we'd like you to note that we have appointments at St. Luke's available both in person and online. Recently, we had a patient who reached out to us about a problem with a painful hernia and worried that we were at maximum capacity with COVID-19 cases. That is not the case. We are able to take new patients, and you shouldn't hesitate to get care that you need. We also take extra precautions to ensure that it is safe for you to come in. Don't be afraid. We're here to help you, and we want to help you. I'd also like to thank Parthay Productions and all the local TV stations for their help in getting out this important message. There's a new TV commercial airing today that features Dr. Ann Stephen from Essentia and yours truly, urging Northlanders to not wait to seek care when they need it. On a slightly lighter note, and as I look out the window, the weather looks great, and it's supposed to be great this weekend. I hope you get outdoors for a walk or something else. Remember to practice appropriate social distancing, wear a mask when you're around people, and don't forget about sunscreen. Back to you, Louis.
Thank you, Dr. Van Dielen, and thank you, Dr. Pryor, as well. I think we'll start things out with a question from John Lundy, who asks, the governor is expected to ease restrictions from the stay-at-home order today. from a public health perspective, is this the right time to do that?
I think it's difficult to answer just in terms of a public health perspective, because there's also the economic perspective, and that feeds into health as well. So I think that governor's trying to really balance things here and do it in a very smart and strategic way. So his announcement, if I'm not mistaken, is at 2 o'clock this afternoon. I look forward to hearing what it is. I think he's very data orientated. He's listening to lots of experts. I anticipate that his goal is to have his cake and eat it too. In other words, maintain the public health of everyone, maintain the social distancing in a smart way, but at the same time, get our economy going.
I would just add, I think our organizations are like many healthcare organizations across the state that have used these past 6 weeks to do really incredible preparations. So we're at a different place than we were 6 weeks ago. And I am, while I certainly wouldn't advocate for wide open return to normal, I think that if this is done carefully, and I believe our governor is approaching it in a very careful, deliberate fashion, we will be in a better place to care for our patients as they need it.
I'll go to a question from Lisa Johnson.
Hello. Is there audio?
Yep, we can hear you, Lisa.
Oh, fabulous. All right. Sorry, I'm kind of ignorant about this. By the way, no meatpacking plants in Fargo, and North Dakotans invented social distancing because everybody lives about 500 miles from everybody else. There's only about 3 people in the state, and that's how we know. My question is, the World Health Organization came out last week and said that there is no guarantee that evidence of antibodies means people cannot contract the virus again. Many or most of our decisions going forward are predicated on this antibody test telling us when we can open up again, when we can start going back to, air quotes, normal again. What does the World Health Organization's announcement of last week mean?
Want me to take that first, Dr. Chambers? You go ahead. Go ahead.
Yeah, I just wanted to try to clarify what the World Health Organization was saying with that is that though an antibody test can tell us potentially whether someone has been exposed, that doesn't necessarily prove that someone has immunity. It's likely that exposure would provide some immunity for some amount of time, but there are too many unknowns there to reliably predict that if you've had the disease, you're totally immune for indefinitely.
Yeah, Rajesh Prabhu. I think one to know to open up the economy is actually more related to how many symptomatic people are out there, meaning how many people are hospitalized, how many people have an infection. And you can go to every health department website and they'll have what they call an epidemic curve. So early on, the number of infections rises, and then you're going to want to see where the peak is when it falls. And when it falls and continues to go closer to 0, that's the more reassuring point in time. All that serology or the antibody tests do is at a later point in time, I guess, helps determine, okay, what percentage of the population had exposure to this virus. It doesn't say, as Dr. Thompson mentioned, that you will be immune to it if you happen to be exposed to it again.
And to build on that, when it falls, the danger, of course, is that people go, oh, we're on the other side. We can go out and mingle and go to bars and stuff like that again. And so that social distancing guard goes down. And then There's still a lot of, assuming there's still a lot of people out there who have not had COVID, they get it, and that's where you get the second curve and potentially the third curve. And why it may not just be one big curve, but could be like a sawtooth pattern. So to answer your question, when we for sure know, I think all of us would agree that it's safe and that we can resume life as we hope and want to, is when we get an effective vaccine. People are vaccinated. And that's when we can really start mingling and having more contact again.
Looks like Lisa, do you have a follow-up?
Yes, I do. I'm curious about your reactions to the order that meatpacking plants be opened. The thought had been in part that meatpacking plants need to be open, and the factories themselves are going to take care of keeping their people safe. Well, their people are. It's kind of been identified, some of these places, as hot spots for COVID-19, so they're not doing that. Do we also need to be worried about food, infected food? Ew. So I guess I'm kind of curious. I'd like to have a response, your reactions to the decision to keep these plants open, and to ask you, perhaps as medical ethicists, your sense of putting people in a position where they have to choose between their livelihoods and perhaps getting sick or bringing illness, maybe death, home to their families.
Yeah, hi, Dr. Prabhu. So, I don't know the details. Obviously, a meat packing plant or any sort of business such as that, it would have to have particular infection control measures put into place to mitigate that risk. That's what we're doing in healthcare in terms of how we screen people coming into work, staff, visitors, patients, what sort of protective equipment that we wear, both visitors, patients, and staff. So I would imagine those measures would have to be put into place. And I think that may be a better question of public health. They do investigations and they try to determine what the factors were that developed, why so many people got infected, and what sort of measures can be put into place to mitigate that risk. And in terms of food, I guess the thought is not ingestion of the virus on a contaminated food is the main route of infection, and hopefully, cooked food as well will kill the virus as well.
Yeah, I think it is important. Food security is important, and we've all seen pictures of, the destruction of fruits and vegetables in the fields, and yet knowing that many of our neighbors are struggling now, and we don't have a real understanding of when, quote, normal resumes. And so I think it is important to think about food insecurity and take measures to prevent that. That being said, we also know that many of these meatpacking plants have become hotspots for disease spread in the setting of COVID-19, and that's because they don't have the infection control measures that Dr. Prabhu mentioned. So if I had to choose, I would not choose to open them until those measures were in place.
So I agree with everything that's being said. My answer to this would have been good time for all of us to become vegetarians. I say that laughingly because I am a meat eater and I love meat, but we do know that vegetarians probably a healthier way to go. So seriously, that's something for all of us to consider, moving more towards a plant-based diet and put decreased pressure on these meatpacking plants.
Amy from WDIO asks, can Dr. Pryor or Dr. Prabhu share more about the plasma treatment being used and how effective is it?
I could. I'll take it, Rogers, probably again. We have the ability to do that. So when we have a person that we feel it's indicated for, we will administer that, but there's really set criteria. You have to be what they say critically ill to have that done. And we're part of a regional study sponsored by the Mayo Clinic. So you have to be enrolled in that study to get that product.
Andrew Thompson here also. We're also enrolled in the trial here at St. Luke's. And there's some initial data showing that people who have received plasma have shown some benefit, but we really don't know ultimately how effective this is. It's promising, but I think we need to learn more about it before we can conclude how good it is.
And Roger's probably, and that's to build on Dr. Thompson's comment. That's why it's being done in a trial setting, so we can analyze, the first whatever hundreds of people that get it and see what the true benefit is of that.
And I think it's, again, as we think about regionally, how great it is to have two high-level healthcare organizations. It's offered at both places, and we've both been are part of this study. So it's just really a credit to the level of care here.
Someone watching online asks, is there any new information related to the return of elective surgeries?
The answer is no. There could be some at the 2 o'clock press conference that Governor Walz is having. We do know that other states are loosening up the elective surgeries. And so I think that this is, I suspect this is imminent in Minnesota is my guess. Right now, obviously we're doing emergent cases, we have to do it right away. And urgent cases where maybe, have to do it within a day, broken bones and things like that. And there's time sensitive ones where if you wait too long, there's potential of irreparable harm to the patient. So we treat those on an individual basis. And if we think that the risk of waiting is higher than the risk of getting COVID, then we will go ahead and do those cases. But purely elective cases, we're holding off on those till we get word from the governor. And the reason why this whole thing, why we're not doing elective cases, why nobody really is right now or shouldn't be, is just to preserve the PPE. And I think that we've got new ways of recycling PPE. We're watching it carefully. And so if the governor says we can return to elective cases, we'll probably start to move towards that in a slow fashion, but always have our eye towards PPE and make sure that we're preserving it for whenever the surge is.
I have a question from Amy in regards to the serology testing. Do you want people to call and offer to get tested?
Louis, can you just repeat the question? Patients to call, and are we supposed to call them to?
No, Amy wants to know, do you want people to call and offer to be tested with the serology testing?
No, I mean, I think it's more for, I can envision it for people that are out in the community and they felt that they had some really severe or illness suggestive of COVID, but at that point they did not qualify for testing based on the testing criteria. It wouldn't be unreasonable, but I don't think there's any emergency for that as long as they've completely recovered. The PCR tests aren't perfect, so I can envision a scenario is, the inpatient setting when they're in the hospital and the tests are negative and you feel suspected and they're still sick in the hospital past the 2-week mark, and that may be another opportunity to test for that.
And Andrew Thompson here. I think there's going to be more to come on this. Public health agencies and other groups are studying serology, and we might know better in a few months how to use the test, who should get the test. For right now, it's really hard to give guidance on that, and I'm not recommending that anyone offer to get tested, or we're not requesting that people do.
Maybe a question for both organizations. Any takeaways, key takeaways from the first week of that expanded testing that we've alluded to, the expanded capacity and kind of that aspirational claim or goal of 20,000 tests per day. But any takeaways from the first week of that ramped up testing?
Well, we've seen increased numbers, and that's been good. That was kind of what we were hoping to see. But I would say not in the numbers that I maybe would have expected, and that may be another indicator of just the variability in presentations with COVID-19, that in fact either there's a very low incidence in our region, and or those who have it, so many are just really not even symptomatic enough to pursue testing. So it's higher numbers, but not as high as I may have expected.
Yeah, Dr. Prab, I guess to build on Dr. Van Dielen's comments, I believe the last couple of days in this region of Duluth Superior area, and we've seen like a 50% increase at least in testing, but the percent positive has actually gone down. So before we're running like 2 to 3%, and I think the last numbers I saw in the 1% range, meaning these symptoms are so non-specific. We're testing people that are symptomatic, but we're also testing people that have, say, planned elective surgeries, et cetera, procedure. So and those are people without symptoms, and that's sort of a standard approach that all healthcare systems are doing. So that's probably also why you're seeing that percent positive go down.
I would say, to build on Dr. Van Dielen's comments, that there's evidence in other countries like Italy and Iceland where the number of the people who test positive, so they've got the SARS-CoV-2, the virus that causes COVID-19, but close to half of them, 40 to 50% of them, are totally asymptomatic. So there's probably a lot of very asymptomatic people out there that have this virus. Hence, why, again, is so important, the social distancing, the wearing the mask, and just being very careful, because there's a lot of people out there that likely have it that don't even know they have it, but can spread it to you, and you can spread it to your family and friends. And it doesn't mean you're going to be asymptomatic. You could get it, and potentially very bad things happen. So be careful.
Another question from somebody watching online. Do you think we will use the at-home testing kits that are coming out? Are they as effective as coming to the hospital, or are there more false negatives? Any information on this yet?
Yeah, Dr. Prabhu. Some of the home test kits, what that means is, my understanding is there's a company called LabCorp that they'll ship you the test kit and sample yourself at home, and you mail it back in. So at least in our region, if we have the drive-through testing or sites, so I think you could do that and get a more reliable result per se, that because we validate our testing, that the platforms that we're using, or the send out is Mayo Clinic, and they validated their test. So I don't see much of a need for that at the moment in our community. I don't know Dr. Thompson's thoughts on that.
Yeah, go ahead, Andrew.
I would just add that there are a lot of companies that are offering tests. For serology, for instance, there are over 100 companies that have offered tests or have tests on the market. There's a lot we don't know about the reliability, the accuracy of those tests. There might be a potential to do home testing with saliva or nasal swabs or other things. But I would basically agree with Dr. Prabhu in that if you want a reliable test, you should come to one of our facilities, because these are validated. We've checked the process, and we trust the result.
Yeah, I think just to build on that, the risk is that you do one of these tests that you receive in the mail where we don't understand the test characteristics, although at least the one I know of is an antigen test. It is not as sensitive as the tests that we're doing for sure. And especially when we have so little disease around, you can't, and it's a statistical explanation that I won't go into, but you are challenged to trust the result that you get. And if you get a positive, for instance, that may give you more confidence than we would hope, because that may not be true evidence that you have had the disease, or if you have, whether you have immunity. And that's the risk, is that you stop socially isolating and you get the disease, and then you share it with somebody who is in one of these high risk categories. So it really isn't, I think, useful at this point, and I would strongly recommend accessing testing through one of our organizations where we know what the testing means.
Well, I don't see any other hands up or questions in the Q&A function here at the bottom. Maybe we could give it a few moments. Otherwise, we can get out of here earlier and heed some of the advice given to get outside and go for a walk. And, looks like somebody is going to. I got one more question here. Is the volume of patients who are hospitalized still low?
I don't know the exact numbers right now, but yes, it's still relatively low. We're still in the early phases.
Yes, low numbers.
Well, with that, I think we will cut out a little bit earlier. No questions, and so again, thank you to everybody who has joined us today. We'll plan on the same time next week, and thank you to the doctors who again take time out of their busy days to answer these questions and chat with us for a little bit. So, thank you everybody, and we will see you again next week.